afternoon and thanks for joining us. I'm Judy Simpson. It often has no warning signs or symptoms, and that's why high blood pressure is called the silent killer. High blood pressure significantly increases your risk of heart disease and stroke, and it's damaging to your organs like your kidneys. Unfortunately, many people don't know they have high blood pressure. It's estimated that 1 out of 3 adults have high blood pressure, but only half have their blood pressure under control. So as part of National High Blood Pressure Education Month, we've called on 2 experts to help us understand the problem and to explain how high blood pressure can be prevented or how it can be controlled if it's already too high. With me is Suzanne Lapointe, who's a registered nurse at the UVM Medical Center, and alongside Suzanne is Robin Edelman. Robin's a dietitian at the Vermont Department of Health. Thanks so much for coming in to both of you.
Good to be here. Okay.
Now, Suzanne, let's start talking about the basic question. What is high blood pressure?
Well, high blood pressure is actually what it means, what it says. It's the pressure in your blood vessels. You're probably, and it's a combination of 2 factors. Mm-hmm. It's a combination of the pumping of your heart and also the resistance of the blood vessels. As you probably know, most of us have had our blood pressure taken, and it's reported in 2 numbers. Mm-hmm. The top number, which is called the systolic blood pressure, and the bottom number, which is called the diastolic blood pressure. The top number is the result of your heart when it's pumping blood into your blood vessels, and the bottom number, the diastolic, is when your heart is at rest between heartbeats. Now, according to you can see the chart, mm-hmm. and it's going to talk a little bit about what's the different terminology and how do we really define high blood pressure, or hypertension as it's also known. A normal blood pressure is less than 120/80, and that's in the green, so that means good. Mm-hmm. You're good to go.
So your doctor says 100/80, great.
It's okay.
Yeah.
Yep, that's good. If you go to the orange and the red, that means that you do have high blood pressure. Red, got to stop, got to think about what to do. Mm-hmm. But the other area, which is yellow, is between, and I'm talking mainly about the top number, is between 120 and 139. And that's an area where we can really have a lot of impact with lifestyle changes.
Which I would imagine is why it's so important to have your blood pressure checked.
Yes. And also in people over 50, it's really, even though both numbers are important for high blood pressure, in people over 50, the top number, the systolic, actually is the most important number. And the reason for that is as we age, our blood pressure, our vessels get stiffer, and we tend to have more disease. So the top number is the one that in people over 50 we really focus on.
So Robin, what causes high blood pressure?
So aging, mm-hmm. And aging without physical fitness. If you're not physically fit and you haven't been exercising, if you're overweight, if you're a smoker, if you're eating a very, very high salt diet, or if you're having a lot of caffeine during the day, these are factors that are going to make your high blood pressure, hypertension come out.
Well, it sounds like a pretty common lifestyle then.
It is, and as we were talking before, making some changes to these things that we'll be discussing later gives you such a great opportunity to prevent this condition.
Okay, Suzanne, so what's the first line of treatment for high blood pressure, and can it be done without medication?
It can, and the first approach would be lifestyle changes. Mm-hmm. So if you see your blood pressure, it's 120, it's creeping up, chances are that hypertension is lurking in your future. Even if your blood pressure is normal at 55 or 60, about 90% of the population will develop hypertension.
Oh, no kidding.
Yeah. So one of the first things that is important is losing weight. And only losing 10 pounds can really have a significant impact on your blood pressure.
Well, that's good news.
Yes. Also getting regular physical activity. And that doesn't mean you have to go out and run a marathon or even do anything particularly active. It's always good to check with your doctor mm-hmm. before you really start an exercise program. But there's so much you can do at home. Gardening, just walking. Walking's great. Taking your grandchild for a stroll, mm-hmm. For 10 or 15 minutes. So think about these things that you can do for about 30 minutes most days of the week. And if you can't do 30 minutes all at once, breaking it up into smaller segments.
The important thing is don't get overwhelmed by all this
That's
list
right.
of to-do things.
Absolutely, absolutely.
And also, of course, eat healthy foods.
Yes, we have if viewers Google the Vermont Department of Health and the DASH diet plan, then they'll see an actual meal plan that addresses the points in number 3, whole grains, filling your plates with vegetables, eating fruits instead of higher fat desserts, snacking appropriately, low-fat dairy products. These are the foods that help lower blood pressure, sometimes as effectively as a medication would. And then reducing salt or sodium where it hides, most commonly in processed foods, and also limiting the amount of alcohol you consume will help lower your blood pressure.
Yeah, it's important to read the labels because I was a big cottage cheese fan until I read the label and saw how much sodium is in cottage cheese.
Exactly.
That's crazy. So what are some of the ways that you can lower your blood pressure?
So we were talking about some of those ways, and we have another visual that would be following the one we just showed that listed some additional ways to lower blood pressure. If you're a smoker, quitting. Yeah, cutting back on the caffeine. Maybe have 1 or 2 cups of coffee in the morning, but not 5 to 10 through the rest of the day. Reducing your stress, even though hypertension isn't caused necessarily by stress, but it will aggravate, for those who already have high blood pressure, stress will aggravate it. So finding ways to calm yourself, monitoring your blood pressure at home, which we'll be demonstrating in a minute, and getting support from family, friends, and support groups. Those are some things that are really helpful.
What medications are used to control high blood
Well,
pressure?
several different medications are used to control blood pressure, and it varies by individuals. And many people really need to take more than one blood pressure medication because they either work differently or they work together. And it's also important to really limit your salt intake to help these blood pressure medications work better.
Now, why is blood pressure sometimes higher in the doctor's office than at home? And is there something you can do about that?
Absolutely. So sometimes we refer to this as white coat hypertension. You see the professional, the healthcare professional in their white coat, and it sends your blood pressure up. I mean, truthfully, by the time you get to the doctor's office, you might have been in a rush. You might be, making sure you want to make that appointment in time. You might not have had a chance to use the bathroom, so you might be approaching this with a full bladder.
I might have to put on a gown.
Yes, exactly. You'll be anxious about the exam, so by the time that blood pressure cuff comes out and gets wrapped around your arm, you might already be pumping a little bit higher than you normally would. And what you can do about that is use a digital blood pressure monitor like the one I happen to have right here. And these are available for reasonable costs from different places. And I'm going to put the machine so you can see it, Judy. But this allows you to take your blood pressure at home or at work in a calm environment. And I'll do this now.
So you're going to demonstrate how to take your own blood pressure.
I am, and I'm going to have Sue do the narration while I focus on this. And I'm going to then let you read the numbers, and hopefully being on television will not accurately, erroneously raise my blood pressure. So.
And just remember, when you're taking your own blood pressure, don't do what I'm doing, is talking during the procedure, or don't do it on television. So what Robin is doing is she's sitting in a chair, supported by her back, her feet on the floor, legs not crossed, probably hasn't had any caffeine in 30 minutes, hasn't exercised, has made sure her bladder is empty, and then she's put on the cuff.
Check.
Yeah, good idea to, have your arm rested comfortably on a table at about heart level.
Okay. And I'm going to press this button, and I'm going to let Judy read the numbers and hope for the best.
Okay. Okay, I can hear it pumping up. Now, when is it usually? Okay, so it's 95.
And I usually sometimes tell people not to really look at the numbers, because if you look at a number that's high, all of a sudden it might make you
121 over 74. That's excellent. Good for you.
All right, very good. I'm going to take this off now.
And so we were talking earlier, and you said an ideal time to do this would be when you just first get out of bed.
Right. And sit there. Make sure that you sit there for, 5 minutes, relax. Now, if your blood pressure's higher than it usually is, you want to sit there for another 2-3 minutes and recheck it, because sometimes your blood pressure does come down. So no matter where you take it, if you're getting a reading that's not your normal reading, recheck your blood pressure. And one thing I forgot to mention is cuff size is very important. Most people can get away with just a normal size cuff, but if your doctor uses a large cuff or you think you really have a larger arm, there are measurements on the cuff to make sure you're using the right cuff, because if you're not using the right cuff, your blood pressure can be falsely elevated.
So the first step is to talk to your doctor about doing this and see if this is something that you need to be doing at home.
Yeah.
And then obviously keep track of the results.
Yes.
And if there are any abnormalities, should you immediately call your doctor?
Well, it just depends.
Yeah.
You know, if you've had good blood pressure, you know, under 120, all of a sudden your blood pressure starts going up, because you don't need to be, if you've got good blood pressure, you don't need to be measuring your blood pressure every time you turn around, you know, but measure it periodically if you're at the pharmacy or if you have your own cuff. If it starts to go up, then you want to measure it over probably a period of time. And, you know, once it gets into that range where it really is over 140, then you really need to be contacting your physician. It's not immediate that you run in that same day, but then that's a conversation you have to have with your doctor.
And if we had to leave people with one number that might prompt an urgent call, I would say maybe 180. If you get a reading of 100,
180, then you really need to contact your doctor. Or, you know, certainly if you're having symptoms that are sometimes not indicative necessarily of high blood pressure.
Let's talk about that, because it really isn't. I mean, you don't all of a sudden break out into a rash or feel sick.
And something to remember about high blood pressure is it changes, and it's something that develops over time. So most people don't have an immediate they don't have something that's unusually high from one day to the next.
Right.
That would be a more unusual circumstance. So you usually have a little bit of time to follow this. Put your readings down when you see your doctor. Bring your readings with you. But certainly if you have shortness of breath, an extreme headache, lightheadedness, and you really feel pretty sick, that's a different situation.
What are some of the barriers that prevent people from taking their blood pressure medications?
Right. Well, there are several, actually. One could be cost. Even though most people have copays, if you're taking several medications, those copays can add up.
Right.
Side effects. You know, some of these medications do cause side effects. So it's really important for these two things to contact your doctor. Don't stop your medication on your own, because some of these medications shouldn't be stopped abruptly. And your doctor can probably, you know, help sort out some of these things by either changing your medication, you know, giving you something that might have less side effects. There's also denial. And oh, my blood pressure, I'm taking medication, now my blood pressure is good, it's 140, so I can stop it. Well, once you have high blood pressure, you have high blood pressure. Now, it might be that if your blood pressure is really well controlled, they might be able to cut back on some of your medications. And the other thing is, you know, life, we all get busy, you know, so kind of coming up with some kind of reminder systems if it's difficult for you to remember to take your blood pressure.
And once again, that's important to remember, because as we mentioned earlier in the program, there really are not a lot of symptoms.
Exactly.
That's
So
right.
you can say, well, I haven't taken it in a week and I feel fine.
Yeah.
And truthfully, too, when we were talking about all the lifestyle changes before that one can do, taking on one or two of them, not feeling like you have to take on all 10 that we discussed, taking on the ones that are most important to you to make an action plan, that will help immediately lower your blood pressure. And then you can feel really good that you're doing something for yourself without worrying that maybe your blood pressure medication has to be at a higher dose. Because some of what we were talking about is if you're on a lower dose medication, then you'll have fewer side effects. Then it'll be easier for you to continue taking your medication. Those two things work together, medication and lifestyle changes.
All right. Well, the important thing, too, is to really know what your numbers are and keep track of them.
Absolutely. And ask your doctor what his or her goal is for you. You know, that can be very individualized. So, you know, we know that under 140 over 90 is what we're aiming for, but your doctor might have a different goal for you, you know, or if you have chronic disease, your goal might be a little bit different.
All right. Well, I want to thank you both for joining me today, and thanks for the demonstration.
You're welcome. Good to be here.
Yeah.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.